Hello everyone and welcome back to Speak Healthy. Today we are going to go over the signs of liver dysfunction so that you can spot them and get treated appropriately and quickly. Your liver, it's the silent powerhouse of your body, working tirelessly to filter toxins and aid digestion. But what happens when this vital organ starts to falter? The signs can be subtle and often go unnoticed. From the mysterious fatigue that keeps dragging you down to the unexpected change in your skin's hue, your body may be signaling a cry for help. Unraveling the mystery behind these symptoms could be the key to safeguarding your health. Let's dive into the early warning signs of liver disease so you can stay one step ahead and keep your body's unsung hero in top shape. Before we start, please be sure to subscribe to Speak Healthy for more videos about your health and well-being. A visible manifestation of underlying health issues, jaundice turns the whites of the eyes and skin a yellow hue. This change in color occurs due to the buildup of bilirubin, a yellow compound formed from the breakdown of hemoglobin in old red blood cells. Bilirubin is usually processed by the liver, converted into bile, and then stored in the gallbladder or released into the intestines to aid digestion. This complex process relies on the liver's health and the seamless interaction between various metabolic pathways. When the liver is healthy, it filters bilirubin efficiently, breaking it down and excreting it. Any impairment in liver function, such as hepatitis, cirrhosis, or a bile duct obstruction, can interrupt this process, leading to a buildup of bilirubin in the bloodstream. Unexplained ongoing fatigue and weakness are common, yet often overlooked symptoms that can be associated with liver disease. Unlike the usual tiredness that everyone experiences from time to time, this type of fatigue can be persistent and debilitating. Fatigue in the context of liver disease isn't just feeling a little tired after a long day. It's a profound and persistent sense of exhaustion that doesn't improve with rest. Weakness may accompany fatigue, making everyday tasks feel unusually challenging. The liver plays a crucial role in metabolism, energy production, and detoxification. When liver function is compromised, it may affect the body's ability to produce energy efficiently. Nutrient malabsorption, hormonal imbalances, and a buildup of toxins that the liver is unable to filter can also contribute to these symptoms. Liver conditions such as hepatitis, cirrhosis, fatty liver disease, and liver tumors can lead to fatigue and weakness. These symptoms may develop gradually and can be easily mistaken for other conditions, making diagnosis more challenging. Loss of appetite, anorexia, refers to a decreased desire to eat, while weight loss might occur as a consequence. In the context of liver disease, these symptoms can be significant and may indicate an underlying problem that needs medical attention. The liver plays a vital role in digestion and metabolism. When liver function is compromised, it can affect the body's ability to process nutrients, leading to a decreased appetite. This disruption in metabolic function can also lead to weight loss. Loss of appetite and weight loss may be accompanied by other symptoms like nausea, bloating, fatigue, or abdominal discomfort. These combined symptoms can provide clues to the underlying condition. Ascites is the abnormal accumulation of fluid in the peritoneal cavity, which is the space between the two layers of the peritoneum, a membrane that lines the abdominal wall and covers abdominal organs. This buildup can lead to noticeable swelling and distension of the abdomen. The liver plays a crucial role in producing proteins that help retain fluid in the blood vessels and also in detoxifying harmful substances. When the liver's function is compromised, particularly in conditions like cirrhosis, it can lead to increased pressure in the liver's blood vessels, portal hypertension, and reduced protein production, both of which contribute to fluid leakage into the abdominal cavity. Cirrhosis is the most common cause of ascites, which is a result of long-term continuous liver damage and may be due to many reasons, including chronic alcohol use, hepatitis, and more. Portal hypertension, which increases pressure in the portal vein system, forces fluid out of the liver's blood vessels and into the abdominal cavity. The liver, among its many functions, processes bilirubin, a yellow compound formed during the breakdown of old red blood cells. The liver's efficiency in handling bilirubin can influence the color of both urine and stool. When the liver is unable to process bilirubin efficiently, excess bilirubin may be excreted through the kidneys, causing the urine to take on a darker, amber or brownish hue. Dark urine due to liver dysfunction might be accompanied by other symptoms like yellowing of the skin, jaundice, itching, or abdominal discomfort. Bilirubin is eventually excreted through the bile, giving stool its typical brown color. If the liver fails to produce bile or if bile flow is obstructed, there may be a lack of bilirubin in the stool, leading to a pale or clay-colored appearance. Pale stools can be accompanied by dark urine, abdominal pain, and other digestive issues. Nausea is an unpleasant sensation of wanting to vomit, while vomiting, or emesis, is the act of forcibly expelling the stomach's contents through the mouth. Both can be indicative of various medical conditions, including liver disease. The liver produces bile, which is essential for the digestion and absorption of fats. Any disruption in the production or flow of bile can lead to digestive disturbances, including nausea and vomiting. The liver is also responsible for detoxifying chemicals and metabolizing drugs. If the liver's function is impaired, toxins might accumulate in the bloodstream, potentially causing feelings of nausea. The feeling of discomfort can arise from distension, inflammation, or damage to the liver itself, or from associated structures like the gallbladder and bile ducts. Hemostasis is the body's mechanism to prevent and stop bleeding. It involves a complex interplay of various proteins, many of which are produced by the liver. Consequently, liver health has a direct impact on this system. The liver is responsible for producing several proteins involved in the clotting cascade, including fibrinogen, prothrombin, and factors V, 7, I, and X. A disruption in the production of these factors can impair the body's ability to form blood clots effectively. The liver also helps in breaking down substances that prevent clotting, ensuring a balance between clot formation and dissolution. Bruises result from blood vessels breaking under the skin. In the context of liver dysfunction, the compromised production of clotting factors can lead to more prolonged bleeding, making individuals more susceptible to larger and more noticeable bruises from minor injuries. These bruises might be more widespread and appear with little to no known trauma. Individuals with liver damage might notice prolonged bleeding from small cuts, frequent nosebleeds, or gum bleeding. In more severe cases, there can be blood in the urine or stools, or internal bleeding which can manifest as black, tarry stools or blood in vomit. Hepatic encephalopathy is a spectrum of neuropsychiatric abnormalities seen in patients with liver dysfunction, particularly cirrhosis. It results from the liver's inability to effectively remove toxins from the blood. These can range from mild cognitive impairments like difficulty concentrating or memory lapses, to severe manifestations such as personality changes, lethargy, stupor, and even coma. Apart from mental confusion and difficulty concentrating, hepatic encephalopathy can present with mood changes, impaired judgment, motor abnormalities like tremors or incoordination, and disturbed sleep-wake cycles. Pruritus, commonly referred to as itching, is a frequent and sometimes debilitating symptom in various liver conditions. While itching can result from numerous causes, its persistent and unexplained manifestation may hint at an underlying liver issue. The liver produces bile, which aids in digestion and absorption of fats. If there's an obstruction or dysfunction in bile flow, a condition termed cholestasis, bile acids can accumulate in the skin, causing itching. The liver is responsible for detoxifying a myriad of substances. If its function is impaired, toxins might accumulate in the bloodstream and skin, leading to pruritus. Navigating the nuanced signals of our bodies, like the mysterious itch or unexplained fatigue, can sometimes lead us to discover the deeper tales of our liver's health. So, the next time your body whispers, lend an ear, because in the language of symptoms, your liver might just be telling its story. If you liked today's video and want to watch more videos like this in the future, don't forget to subscribe to Speak Healthy for more content. Thank you all and see you next time.